So here we are in Fort Myers, Florida, with a very fascinating patient with an unusual issue that we addressed. And what was fascinating about this patient, not only is he's an extremely educated man, a former cardiologist, now living in Naples, Florida, but from New Jersey with his lovely obstetrician gynecologist wife, who is also I guess semi or full-time retired, and he's just playing down here. But he had cataract surgery in both eyes. And the interesting thing is, although his vision was just about 20/20, there was a problem associated with it that nobody could figure out. Well, I wouldn't say nobody, but basically, you had a cataract. You were told you should have a capsulotomy to make sure there wasn't any haze developing on the membrane behind the implant. But interestingly enough, after your capsulotomy, you felt your vision was worse, and it wasn't your visual acuity, correct?
Correct.
And what your symptoms were was this unusual glare phenomenon, and a glare phenomenon associated with something floating by your field of vision. Right. Your operating surgeon, who did a nice job, if I don't say so myself, it looked nice, implanted what we call a toric lens in your eye. Your visual acuity was very good. She couldn't figure it out. She referred you to one of our notable retina guys down here, and he is a very, very respected, educated ophthalmologist. And of course, you went in, you told him your symptom, and how would you have described your symptom to him?
That there was this issue where my vision was clouded over, but it would occur in a rapid succession and continue for 7, 8, or 9 seconds, which interfered with my ability to see and made it impossible to drive.
But it wasn't exactly clouded over per se. It was like you described it, like when you looked right or left, it was like a flash of light going across your field of vision.
Correct.
It wasn't your run-of-the-mill.
It was an issue where this glaring sensation became a bright flash that came across and would obscure the vision for several seconds.
The flash itself, not a shadow. The flash obscured the vision.
Correct.
So it definitely was unusual, and being the articulate guy that you are, you probably described it to a T, but nobody ever heard that before because people aren't quite that articulate. And of course, you went through the usual tests, fluorescein angiogram, B-scan ultrasound, I don't know what else, OCT of the macula, retinal checks, and of course, everything came up negative. Is that not true?
Correct.
Now, lucky you took a leap of faith and called me because you thought this might be related to a floater?
I thought it might be related to some issue between the capsule and the retina, since it wasn't on either end.
Right, exactly. So this occurred, post-capsulotomy almost immediately. And the interesting thing about your symptom was, and like I said, you came to the right place, because I have seen this before, and I have never seen it described in the medical literature, but I'll describe for whoever's listening to this video exactly what it was. You had a capsulotomy on a fairly clear capsule, and when that happens, the capsule rolls up like a scroll. So at either side of your implant, you had this scroll. Your implant, being a toric lens, lies very far posterior in the eye. And when you get ambient light at the horizontal meridian, for example, if the sun is going down and it's shining from the side, that ambient light will refract off of that rolled piece of capsule and cause a streak of light at 90 degrees to what it is, or what the capsule is. And I got that to a T. Was I not correct?
That's good description of it.
And I wanted to do your case so bad I was willing to pay you money for doing do it. But I had seen that once before where a patient who came down for a floater said, and they had 20/20 vision. She said, my capsulotomy make things worse. I can't drive. I see these bumpers and it's just too much. She was talking about chrome auto bumpers. And it was exactly the same thing. The capsule had a roll on it. I figured it was acting as a cylindrical lens. We used a laser to dissect that away, and that glare phenomenon was gone. Of course, you also had the other glare phenomenon of the flash of light that would move across your field of vision. Well, what that was the actual center part of the capsule that rolled up and was lying in the anterior vitreous. And when this would go across your field of vision, you would get a flash of light at 90 degrees to the orientation of the roll of capsule. And we pretty much got that too, right?
Correct.
You were a most fascinating patient. I'm so glad you were here. And like I said, I got paid for it. I would have done this for nothing or even given you money just to prove that I could do it. So thank you so much for being a great patient. I appreciate that.